My teeth are falling out. What should I do? 4 immediate steps to take. If your teeth are falling out, there's some serious concerns at play. Here are 4 things you should do to address the problem. Number 1, seek dental care immediately. Schedule an appointment with a dentist as soon as possible. They can assess the situation, determine the cause of your teeth falling out, and recommend appropriate treatment. Besides a traumatic accident where you got hit in the face or fell, there's really only one reason your teeth could be falling out, and that's an untreated case of severe periodontal disease. Periodontal disease, also known as gum disease, is a bacterial infection that affects tissues surrounding and supporting the teeth. It can range from mild gum inflammation, gingivitis, to more severe forms that can lead to tooth loss and damage to the jawbone. Here are the 6 key aspects of periodontal disease. Number 1, gingivitis. This is the earliest stage of periodontal disease and is characterized by inflammation of the gums. Symptoms may include redness, swelling, and bleeding during the brushing or flossing. Gingivitis is usually reversible with proper oral hygiene and professional dental care. Number 2, periodontitis. When gingivitis is left untreated, it can progress to periodontitis, a more serious form of gum disease. In periodontitis, the inner layer of the gum and bone pull away from the teeth, forming pockets that can become infected. Over time, the infection can lead to bone and tooth loss. 3, causes. Periodontal disease is primarily caused by the buildup of plaque, a sticky film of bacteria that forms on teeth. Poor oral hygiene, smoking, hormonal changes, certain medications, genetic factors, and systemic diseases like diabetes can all contribute to the development and progression of gum disease. 4, symptoms. Symptoms of periodontal disease may include persistent bad breath, red or swollen gums, tender or bleeding gums, painful chewing, loose teeth, and receding gums that make teeth appear longer. 5, treatment. Treatment for periodontal disease depends on the severity of the condition. It typically involves professional dental cleanings, scaling and root planing, to remove plaque and tartar from below the gum line. Medications, such as antibiotics or antimicrobial mouth rinses, and in advanced cases, surgical procedures to repair damaged tissues or restore lost bone. 6, prevention. Good oral hygiene practices such as brushing twice a day, flossing daily, and regular dental checkups are crucial for preventing periodontal disease. Avoiding tobacco products, eating a balanced diet, and managing systemic conditions like diabetes can also help reduce the risk of gum disease. Early detection and treatment of periodontal disease are essential for preserving oral health and preventing complications such as tooth loss and systemic issues linked to gum disease. Regular dental visits and maintaining good oral hygiene habits are key components of preventative care. Number 2, seek medical care immediately. In cases of severe neglect of hygiene, periodontal disease can sometimes be treated with dental treatment alone. In my experience, this is actually kind of rare. Most cases I see of severe periodontal disease in my practice are related to smoking or uncontrolled diabetes. When I see patients with severe periodontal disease, I need to know the last time they had a medical exam. There are many people living with undiagnosed and uncontrolled type 2 diabetes, and we need to get to the bottom of this to get the patient's dental health under control. Our treatment options are very limited if a patient has uncontrolled diabetes. We can't even think about dental implants in these patients. It just won't work. I also recommend to patients that smoke to seek advice from a medical doctor. Seeking advice from a medical doctor is highly recommended if you want to quit smoking. Smoking cessation is a significant step toward improving your oral health. Medical professionals can provide valuable support and guidance throughout the quitting process. Here are a few reasons why consulting a doctor is beneficial. Number 1, personalized advice. A doctor can assess your individual health status, smoking history, and any underlying conditions that may be affected by smoking cessation. They can tailor their advice and recommendations to your specific needs and circumstances. 2, medication and therapies. Doctors prescribe medications and therapies proven to help smoking cessation. This may include nicotine replacement therapies, such as patches, gums, or lozenges, prescription medications, or referrals to smoking cessation programs or counseling services. 3, health monitoring. Quitting smoking can have various effects on your body, including withdrawal symptoms, changes in mood, and improvements in lung function and overall health. Doctors can monitor your progress, address any concerns or complications, and provide ongoing support as you work toward being smoke-free. 4, addressing concerns. Some people may hesitate to quit smoking due to fears of weight gain, nicotine withdrawal symptoms, or relapse. Doctors can address these concerns and provide strategies to managing cravings and withdrawal, and offer encouragement and motivation throughout the quitting journey. 5, long-term health benefits. Quitting smoking significantly reduces the risk of developing smoking-related disease such as lung cancer, heart disease, stroke, and respiratory conditions. Your doctor can discuss these health benefits with you and help you stay committed to your goal of quitting smoking. In summary, Involving a medical doctor in your smoking cessation journey increases your chances of success and ensures that you receive comprehensive support, guidance, and resources tailored to your needs. Don't hesitate to reach out to a healthcare professional for assistance. It's a proactive step toward improving your health and well-being. 3. Work on your diet and hygiene. If your teeth are falling out, your dental problems are quite severe, but it's never too late to right your own ship and to improve yourself, to improve your life. Even if your teeth are in a hopeless state, cleaning them every day and eating healthy is going to make you feel better, cleaner, and put you in a positive frame of mind. Number 4, get educated on your options. Once you find a dentist that you trust, learn as much as you can about the treatment options that your dentist is proposing to you. Let me give you a little outline of different types of discussions I have with patients that are losing their teeth. One group of patients I see is in complete denial of the problem and hasn't wrapped their head around the severity of the problem yet. They aren't receptive to talking about the problem and can't really have a great discussion about what to do because they're just not ready to talk about it. Another group of patients I see has an idea that the problem is severe. They're ready to do something about it, but they have extremely limited knowledge about the options that are available to them. These discussions go better, and sometimes it takes more than one discussion for a patient like this before we finally figure out what's best for them. The last group of patients has done some research. Maybe they've seen a few dentists already. They know what options exist for them, and they're very fluent in lots of dental terminology. They're just looking for the right dentist for them. These discussions are usually the easiest ones to have when the patient already has some idea what the problem is and what they want to do about it. While it can sometimes be dangerous for patients to do all their research online, it's just the world we live in today. I find most patients are actually quite good at sorting through what makes sense and what doesn't when it comes to researching topics on the internet. In summary, if your teeth are falling out, seek dental care immediately. It's a serious thing. I hope you find this helpful, and please share this video with somebody that needs to hear it.